Welcome, Christina.
I think so.
Okay, so I'm Bill Code, of course, author of Solving the Brain Puzzle, and my new assistant or co-author is Christina Mitz. Of course, Christina, it's very apropos for today's talk about Parkinson's, because one of her major strengths was as a therapist in our gut floral transplant clinic, which has a lot of impact and potential place within the Parkinson's group. And so part of our discussion today, we'll talk about that in the other. So as we've talked about, I mean, this is the next chapter in the book, and today it's on Parkinson's. Parkinson's, of course, is an illness that happens in the substantia nigra of the brain. It starts probably many 20 and 30 years before we get diagnosed with it, with our symptoms, typically of the tremor is one of the common ones, freezing and walking, depression like facies or face, and sometimes problems with swallowing. The most early one that happens in 80% of Parkinson's patients is constipation. So that's a great clue. We better talk about the gut. So that's part of our intro today. Parkinson's, of course, happens in that region of the brain, and it's a problem with movement, and it's almost with a freezing walking motion, and it's a problem with tremor. It can be a problem even with cognitive ability and memory, and goes on to those features, and then even sometimes problems with speech. But interestingly enough, I met a woman in Edmonton a number of years ago, and she had a dual master's specialty. One was in voice and one was in speech language pathology. And she had a considerable great success in choirs. People that had difficulty speaking could sing really well, which tells you it's a different piece of the brain, it's a different component, but every time you did the singing, then usually the verbal parts worked better for a time. So I think this breaks us back to one of the cheering things about Parkinson's is that there's a neuroplasticity with it. We have an ability to recover it. And, you know, I've got a new update that I'm putting as I revise our first edition, which came out in 2019. I was lucky in the fall of 2019 to meet John Pepper, and he's in his 80s now, very brilliant fellow, a businessman. He worked out himself. If he walked 5 miles or 8 kilometers 3 times a week, all of his Parkinson's symptoms pretty much would stay at bay. And he was able to get off all of his dopamine or dopamine type agents, L-Dopa, which is a common treatment. But unfortunately, almost always quits working after 2 or 3 years. Anyway, he was off all those medications, and so much so that, you know, the other. So the very fascinating thing about meeting John Pepper, and he's the one that was talked about, of course, in Norman Doidge's book, The Brain's Way of Healing. He did a major chapter on exercise and Parkinson's. And the special thing about John Pepper was, I thought when I met him that he'd maybe been a couch potato and he was diagnosed with it, and he got into exercise, walking, and it made them better. Au contraire. In reality, when he was diagnosed, he was in probably his 50s, and he was a gym rat at that time. He was doing roughly 2 hours a day, 6 days a week in the gymnasium with major workouts and exercise. So my concept of a couch potato went out the window, but the very most dramatic component for him was the walking. There is something very neuroplastic helpful about walking. So walking means walking briskly, you know, using both arms and legs as we all normally do. As your arm goes forward, your foot goes back on the opposite side, ipsilateral side, and so on. So it's walking is the most important piece to do. That doesn't mean it's the only piece to do, because we know exercise increases the other brain recovery component, BDNF, or brain-derived neurotrophic factor. So as we, you know, try and take apart the pieces of what's happening in Parkinson's, I've talked about the region of the brain. We know that some of those cells are getting injured. By the time you're up to your tremor, we may have 60 or 80% of those cells injured. I used to say dead, and now I'm less prone to do so because I think of some of those cells are still quite salvageable. All right. They're still able to reverse their lack of well-being. So that helps give us all credence as to some of the triggers for Parkinson's. Okay. So Parkinson's comes in a couple of groups. One would be injury to those cells when we don't know why. And the second group would be injury to those cells due to a toxin, a neurotoxin. And there's a lot of suggestion that some of us, and this is particularly noted commonly in farmers who used a lot of weed sprays and insecticide sprays on their farms, they're much more prone to Parkinson's. So the toxicity angle, it comes up partly in heavy use, and it also probably comes up in those of us who have a variation in how well we handle those toxins. And then, of course, the big one that's on the list that we can change to how we handle those toxins is reduce our glyphosate or Roundup derivative intake, because, of course, that slows down the liver function, which increases the toxin. All right. And if we let the liver recover, it's better. And then the secondary part of glyphosate, of course, is it's an antibiotic, so it injures part of the microbiome. So that may aggravate the whole feature. So let's go from there and talk maybe a little bit about some of the microbiome we might find early on in that constipated individual, and maybe you could even take it a little further and give a bit of a case study or case report.
Sure. So I wanted to look at which microbes came up for those with Parkinson's. And it was really interesting. There were a couple things that were kind of abnormal. For example, they actually tend to have high bifidobacteria and high lactobacillus. So maybe there's like a SIBO component there.
Those are our old buddies.
Yeah.
We want more of those usually.
Yeah.
Okay.
They also have high akkermansia, which is kind of similar to the multiple sclerosis. So maybe like high mucus turnover or something like that, or maybe not enough turnover of the mucus, which feeds the akkermansia. Let's see, low fecalibacterium, which is one of the main butyrate producers.
Okay, and butyrate's one of those short chain, fatty acids that we need for cellular health of the microbiome.
Exactly. Low Prevotella, which, as we know, there are some good species of Prevotella and some bad species. And so if you have low Prevotella, you're more predisposed to having food sensitivities.
Yeah, and that's a very interesting one, Prevotella, as well, because it's the one that seems to be a buddy of COVID-19. So often the people that do best when they're diagnosed or having the symptoms of early COVID, they tend to do best if they're put on azithromycin or doxycycline, which are antibiotics that work well against Prevotella, because Prevotella is in the sinuses and upper airways, and it can spread into the lungs and be a significant factor in bacterial pneumonia. So if we treat it early on, then the whole challenge of so-called COVID is diminished. So Prevotella, although you're saying in Parkinson's, it tends to be on the low side. So, and again, as you will explain, it really matters which subsets you have, not just the number.
Yeah, exactly. And like this isn't really listing strains, it's just listing the genus so far, or at least the list that I put together. Rosaburia, which is another one of the butyrate producers, tends to be low. And then within more of like the specific species, the Akkermansia mucinophila, so the species of the genus Akkermansia, high, which we already would have suspected. Bifidobacterium bifidum is low, so that specific species of the genus Bifidobacterium. And then there are a couple important lactobacillus that are actually low. So I think overall with the genus Lactobacillus, the genus is high, but maybe some of the important species of Lactobacillus and Bifidobacteria are still low.
So we may still do well with our either probiotics or prebiotics, which boost the so-called friendly or optimal ones to have more of,
Yeah.
which would compensate for the excess amount of some of the others, because you bring the quality ones up, and that relatively reduces the others. So don't use your old concept of so-called bad germ theory, but instead look at the interactive of the whole mix. Get the diversity back within that genus.
Yeah, and then to prove that point, do you want me to talk about the case study of the client who came?
Yeah, why don't we go into that one just to kind of lead people into it, and then we'll talk about some of the reasoning why people started to look at that.
So Bill and I first started working together when we decided to start up FMT clinic, so fecal microbiota transplant, also called MTT, microbiota transfer therapy. And that essentially is just taking stool from a healthy person and putting it in an unhealthy person. And there's a lot more to it than that, but that's the simple explanation. And so we did have one Parkinson's client who came, and he went through the 10-day program with us, and it essentially cleared up his symptoms, but only temporarily. So his symptoms cleared up, and then a couple months later, he called and he was like, well, things are starting to come back, but that was so potent, I'd like to come back and do more. And so he came back for another round of FMT, and then we were chatting about potential heavy metal exposure, and I encouraged him to look further. And then with his other healthcare provider, he ended up finding out that he had Wilson's disease, which I think you should explain.
Well, Wilson's disease is a rare entity, but it's excess copper, because we're unable to clear the copper from the body. So copper can be in, like all metals, pretty well, even the trace minerals. We need a certain amount of them, but if we have an excess of them, we're in trouble. So the easy first-time treatments in people with a borderline high copper, fine, you're going to give them extra zinc, because it's very much a teeter-totter between zinc and copper. One goes up, the other one goes down. But in Wilson's disease, it's much more dramatic, and they get into some very major brain troubles, and one can present as Parkinson's. The good news is it's somewhat very treatable, but you have to be very aggressive. And once it's diagnosed as Wilson's disease, regular medicine is quite on board, knows what to do. It's often a mixture of medications or some variation thereof, but they tend to do well. But the tricky part is them getting diagnosed. And so this fellow was quite a while into his Parkinson's journey by the time he got to that. So the other interesting thing, probably useful for people, is what kind of major symptoms did he have which improved with his 10-day course, 5 days 1 week and 5 days the next, of the gut floral transplant?
Tremors. He had tremors all down the right side of his body, which made it difficult to write and do kind of like everyday activities. So those dissipated. And he was also a lawyer and head of his firm. And yeah, it was a high pressure, high intensity job, and he needed to be very with it. And so the FMT allowed him to have I guess the clarity and the mental power that he needed to continue doing that work.
Yeah, so and that's a very interesting piece, because that was one of the pieces I got when I first had it in 2017. I got a degree of improved clarity. And just like he was, when you're used to using your brain to a considerable degree, it's much nicer when it comes back and clicks into place better, more often. And it's an ongoing search and journey to try and get those pieces. So that's a pretty nice example, and it also alludes, because he was obviously right-handed, problems with writing. And I remember, and I mentioned this in the first chapter in the book, I had a friend that I knew from medical school about the time when he was 43 probably. He was diagnosed with Parkinson's, and I was diagnosed with MS. We were both farm kids from Saskatchewan, very well enough. So maybe there was a toxin component for each of us. Mine was probably in very much part of it, the metal path, because I had a huge mouth of amalgams and mercury excess, and that's really hard to get rid of. And then I had quite a lead excess, and that might have been tractor work, all that lead exposure from leaded gasoline, because we were a gasoline tractor at that time that the young kid was running, because the diesel tractor was run by dad or whatever. So to take those parts pieces apart. The other part that was partly diagnostic for him, and what it reminded me of was you talked about the fellow's difficulty writing. In his diagnostic interview with the neurologist, they asked him to write on the blackboard, "Mary had a little lamb." And when he did that, he got the word, he figured it out himself, because he knew that when you write, when you have Parkinson's, the writing gets smaller and smaller and smaller as you put down that phrase. And it's called Micrographia, and it's almost diagnostic for Parkinson's. Okay, so there's a lot of feedback loops go on within the brain when we do things, including writing, and some of them just aren't working optimally when we get into that stage. So we have trouble with the other. So, you know, I think that's a useful. So now that we've kind of laid that groundwork, we know the gut matters. One of the early clues is constipation. All right. So people that are constipated, typically they're constipated for 20 years before they get the Parkinson's piece. What does that tell us? That tells us, well, it may well start in the gut and then work its way up to the brain. And we've learned in previous talks, the superhighway between the gut and the brain is the vagus nerve. And the vagus nerve is very huge in that. As an anesthesiologist, I used to think of the vagus nerve, it was my best friend. When the heart rate was slowing, I gave some antivagal stuff, you know, so that I could slow or increase the heart rate, right? Because the vagus nerve can be parasympathetic and slows down the heart rate. So when you need it to come up, you would block the vagus nerve. But the vagus nerve is much more than that. Probably 90% of the traffic on that superhighway between the gut and the brain is from the gut to the brain. And we know now bacteria can travel that path. And we know now, and this is even somewhat since the book, the brain can also have its own microbiota, okay? So we used to think, oh no, there's sterile parts of the body. Yeah, no such thing. Almost entire body has a team of cells in it which include the microbiome, which includes, of course, bacteria, fungi, viruses, and archaea, a single-celled organism. I think that's one of the terms we can use anyway. So the studies on the vagus nerve, this is pretty interesting. So I'm old enough, early on in my medical career, when they treated people with gastric ulcers, they did a vagotomy and pyloroplasty. So that means they dissected into the gut, and they cut the vagus nerve on both sides, because there's one side, of course, and then they did a variation in how the stomach emptied. Okay? So as a consequence, ideally, it reduced acid secretion, and then that whole operation and part of the general surgeon's livelihood disappeared because we developed drugs like initially cimetidine and then ranitidine, and you've heard all the other ones since. And now we've got protein pump inhibitors, which are in the same family, but a little even more potent. So we never talk about vagotomy and pyloroplasty, but a clever woman in Scandinavia decided to study that. So it was a retrospective study, fair enough, but they had a large number of people with Parkinson's. And so they had lots of people that had a vagotomy and pyloroplasty. So remember, that's cutting both parts of the nerve. And when they studied those carefully, if you'd had the vagotomy, you dramatically reduced your risk of Parkinson's later in life. So this was suggestive evidence, pretty strongly suggestive, I think, and a painless study to do, is that if you could reduce that vagal traffic somehow, maybe you could make a difference to the other. Or more importantly, go right back to where the traffic came from, which would be the microbiome in the gut. Right? So that's when we started to get even more interested in the gut. And other researchers did some very brilliant research. They took a group of mice which were effectively sterile, meaning they didn't have really any microbiome or gut bacteria to speak of, and they gave them bacteria from either a person with Parkinson's or another group of mice, similar mice, a group that didn't have Parkinson's. And lo and behold, in the ones that had the Parkinson's type feces started into their microbiome, developed the symptoms of Parkinson's. Again, quite suggestive of the problem. And they did have another group of mice if they gave them a major antibiotic for a time that already had Parkinson's symptoms, they could minimize that, okay? So we're learning that what microbiome we have, and that's why we got into it kind of early when you started talking about the groups, but every month or two now, there's another paper coming out on the microbiome in Parkinson's, okay? So let's, just before we get any further in it, I should summarize, there's a few changes happen in that substantia nigra in that part of the brain. And that happened probably also early on in the gut. So this is an extra protein which is secreted, and it's usually in relation to toxins. It's not unlike the ones that we see in Alzheimer's. And the one that we see in Parkinson's and Lewy body disease is called alpha-synclein. Okay, so alpha-synclein is increased in Parkinson's patients, and it's very much there in Lewy body patients, which is kind of a subset of the same. And it's another marker that the body is trying to solve something. And it's usually solving a toxin, but as we learn more, it might be a component that's coming from the microbiome, which isn't ideal for the body or brain, so it tries to cover it up. And we know now that that happens actually first in the gut. And then secondarily, it happens in the brain. And it may not transfer from the gut to the brain in those people that we cut the vagus nerve, or not as well. I mean, it can still get to the brain. It can find other pathways, including the bloodstream, all right? But, you know, it's got an inside passage when it has its superhighway, the vagus nerve. So I think that starts to build us further into what we can do for people with an early diagnosis of Parkinson's. So we try to find out, are they in the toxicity group? Okay, and that's sometimes an easy given, depending in their workplace. And we need to try and get them out of the workplace, try to get them healed up. So we want to quit putting the toxin in the top, and then you want to reduce the toxin, whichever way you can do that. Sometimes that's by dramatically increasing the body's glutathione, because that's one of the things primarily that will bind to the toxins, and then the body can reduce it. In the old days, I used to talk about whey protein. Quality whey protein high in cysteine helped the body make more glutathione. It was useful for me when I was up to 50 grams a day. And then more recently, some of us will, or instead of, will use N-acetylcysteine, which again increases that cysteine molecule, which is the rate-limiting step of the 3 molecules or amino acids that are used to make glutathione. And of course, Dr. Perlmutter and others have used intravenous glutathione. Intravenous glutathione might take the symptoms away completely in the Parkinson's patients, but it only lasts a few minutes, maybe an hour or two if you're lucky. So we know it may be helpful diagnostic. It might give us a path that we should work on, but you can't run around getting a continuous intravenous glutathione. That's just not going to be practical or reasonable, but it might give you a clue, an increasing clue that if you can bring up the glutathione and the other important antioxidants, and kind of my favorite go-to antioxidants, you mentioned them a bit earlier, you know, CoQ10, no question, 200 milligrams 3 times a day. And alpha-lipoic acid, because both of these can cross the blood-brain barrier, all right? And then the other one, which may be quite helpful, would be resveratrol, because you can do resveratrol capsules. You know, drinking jars of red wine might be entertaining, but it's probably not a very fast way to get your resveratrol. And as my vineyard friends say, Pinot Noir's got the highest resveratrol. Okay, and that is all true, but it may not be where you should get all of your resveratrol, just from a getting a ton perspective. So, and then the fourth one would be curcumin. So curcumin's a little more tricky. A, it's hard to get it absorbed into the gut. And B, it's maybe a little hard to get across the blood-brain barrier. So it's one of the suggestions why Alzheimer's is pretty uncommon, for example, in India, where curcumin is used a great deal. But I'm not sure how we can necessarily know that we're getting it across the blood-brain barrier, because it's trickier to cross that than it is the other. The blood-brain barrier is not dissimilar to the lining of the gut, okay? But it's primarily endothelium, or the lining of the blood vessels. So anything we can do to improve the well-being of that may really matter. And that might tease us back to some you were alluding to earlier. If we can improve the diversity of the microbiome in the gut, and particularly the ones that team up with the gut lining cells, and they work together as a team for healthy blockage of permeability so that the good things get in, but the not so good things don't get in, then we're at a much better step. Yeah. In your reading more recently in the last year or two, partly since the book came out, do we talk much about LPS, or lipopolysaccharide, which is a breakdown product of gram-negative bacteria? I haven't read too much about that being around in Parkinson's. Have you?
I haven't yet, but I kind of feel like it's a given that it would be.
Yeah, well, and it could well be. And we know that LPS is a real problem for causing brain problems. You know, it's microemboli of LPS is one of the probable trigger factors of MS, and it's used in the MS model of triggering MS in a lab animal. But it's also there in Alzheimer's, and I suspect it's partly there in Parkinson's as well. So,
I think toxins from the gut in general are going to bring up oxidative stress. So I would be looking for high LPS. I'd be looking for ammonia, maybe high lactate. Some of the other toxins we can test for now, hydrogen sulfide, methane, ethanol, those types of things.
Yeah, yeah. We don't always call ethanol a toxin, but it is just because we don't want to talk about it, unfortunately. So just to reiterate back, because we're talking about ethanol, we're talking about things that act on the liver and on the gut, of course, you know, is just to remind you, get your liver as healthy as you can, because that will give your microbiome as healthy as you can. So if you're abusing or using a considerable amount of ethanol daily, you're going to compromise your liver and you're going to compromise your microbiome. Because the microbiome, we get a particular kind of subset in the alcoholic, don't we? Continuous ongoing bits of alcohol. It's not optimal.
Yeah, definitely. And just to drive home another good case study, this person, so I just had a follow-up with a client earlier today, and her main concern was dysphagia, so difficulty swallowing. And the only thing we've been working on over the past year is reducing toxins coming from her gut, so LPS and everything else. And she's had a 50% reduction in her dysphagia.
That's outstanding. Yeah, and dysphagia is not uncommon in Parkinson's. Unfortunately, difficulty swallowing, sometimes drooling. All of these seem to be components, and the same with the difficulty swallowing. Sometimes people will get heartburn or discomfort. And that's probably from things not going down well, or the esophagus working optimally, or even the valve at the bottom of the esophagus not closing optimally. And so we get some regurgitation of acidic, and then we get the sensation of discomfort. Or, as you alluded to earlier, we may be getting problems with things moving through the upper GI tract, and even getting, as you mentioned, you can test with some of the gases. Are we getting small intestine bacterial overgrowth? Or SIBO. And we don't talk about it in the literature yet, but SIBO is a relatively new diagnosis, and most of these people with Parkinson's are in the older age group. But tragically, Parkinson's is going down into a younger and younger age group, probably due to the toxins that we're increasing all the time in our environment. Yeah. Okay, so I'm just checking. Do we have any questions?
We do. We have a couple questions. So we can start out with Roger. I was on azithromycin, cenflexim, single one-time dose, which I've never done before, always over a week or so. But this seems to be nuclear, and I've had diarrhea ever since. I've made my homemade yogurt, Yo Gourmet probiotics formula, usually with goat milk, but I only had cow's milk on hand. I'm wondering if it's the cow's milk, which hasn't been a big problem recently, but maybe I'm more sensitive with this latest challenge. By the way, in the past, I've used the Vita Biosa, but it didn't seem to help. But maybe I should give it another go.
Okay, so you bring up several good things there, Roger. And one that I missed on the go-around. There's a major tie-in between cow's milk and problems with severity of Parkinson's. So one of the optimal things you can do is take it completely out of your diet. Now, we've said that before because cow's milk has got an 80% overlap with gluten sensitivity, and gluten and secondarily cow's milk are two of the major irritants to gut problems, aggravating all gut permeability issues and aggravating leaky gut. So that's an important piece in there. But thanks for bringing it up, because stay off dairy. Short story. I mean, a few years ago, I saw a fellow who'd made his life in a dairy farm. Fair enough. But not uncommonly, people like their milk. They love their milk because, of course, it has casein in it, which in the body becomes caseomorph, which is a morphine-like substance on the brain. But we don't like to give it up. We get addiction qualities of grumpiness and irritability when we go off it. So we keep doing it because we get that nice feedback loop. But don't go there. Find other feedback loops. Maybe it's going to be chocolate. Who knows? But find other feedback loops and avoid the dairy. So in the single-use antibiotics, I mean, you talked about it. Azithromycin is one that I mentioned earlier about the Prevotella, right?
Mm-hmm.
And so the diarrhea since is probably a significant upset. So I would look at that probiotic, or the soil-based probiotic might be a place to go. Any other suggestions that you would make?
Well, it is possible that with the one-time antibiotic use, he lost some of his lactose degrader. So if he was able to break down lactose before, maybe now he can't because of the antibiotic. You can also make yogurt with non-dairy milks like coconut milk. It can be challenging sometimes, but you can add things like you can add prebiotics to your coconut milk to help the probiotics proliferate, and it'll make it thicker.
Okay. So, that's a reasonable place to go. And we found it mattered which bowl we used to using coconut yogurt. It's a tricky one. I've known some people that have success in it for months and years. Well, we're not quite in that group. We get intermittent success. So we have another question from Arlene. So thanks for that. I have familial essential tremors in my head that she is able to control considerably with a vitamin B12 shot every 30 days. And she also takes Immunocal, which is a whey protein isolate, which is quite high in cysteine, and it's been very gently treated, because if you overtreat, and European pasteurization overtreats by excess heat, it injures that cysteine amino acid. Okay, so Immunocal has counteracted that, so they've got that problem solved. It's produced by Immunotech Research in Montreal, and I did do some traveling on the road for them some years ago. So there is other sources, but that's a reasonable one. So do you have Parkinson's in your future? Well, essential tremor doesn't always become Parkinson's, but it's up on the list. So if I was in your shoes, I would be looking at all the Parkinson's considerations and thinking about something else, okay? Happily, Immunocal and a quality whey protein doesn't typically have any casein in it, or virtually no casein in it. So you may be able to tolerate that for a time. I took a lot of it, almost 50 grams a day for over 10 years. I can't tolerate it now. Unfortunately, I get a phlegmy, froggy throat, and I just can't go there, even if I'm using a very good, nice, clean one like Immunocal. So it's a matter of degree, and you can't push too many pieces up the rope one direction or you end up with a new problem. So I would continue, and I would look at doing B12 more frequently, okay? Once a month is going to give you a big spike and a big slowdown. So I know lots of people now that do vitamin B12 weekly, or they do it at home. And sometimes in children where it's making a dramatic difference, they're doing it daily, okay? Because B12, like all B vitamins, or many B vitamins, it's water soluble, and it's got a short time in the body. So you may do much better with more frequent, or you may look at some microbiome choices to increase the B12 that you have that you absorb and use. When we measure B12 in the ordinary medical system, we're measuring every single B12 in the body. But not all B12s are created or work equally well. So we need to have a bit of a spectrum. You may be able to reduce that and stay with you once a month if you go on oral B12 daily, and ideally it might be sublingual. Because, and as we get older, this begets potentially more and more of a problem, because as we get older, we get reduced acidity, we get reduced production of so-called intrinsic factor of Castle in the stomach, and all of a sudden now we've got less B12 than we ever had before. And that other two things that go with B12 often as a common neurologic injury potential problem are B6 and folate. All right, and that's why people have made the under the tongue combination of the three, or sometimes they can get away if they just take enough B vitamins orally. That might be twice a day. And so my favorite one has got a very good quality folate in it, hopefully methylfolate in it, because these work better. And as we've talked about before, there's a subset of the population, 20-25%, will need more of these than the average bear will. All right. And then there's about a 5% that need even more. And that's just because of their individual genetic variability in the MTHR pathway. Yeah. So I think I covered part of the B12 issue, but I would think essential tremors to me are a clue. You're going to be more susceptible to the tremor-like illnesses later in life. And the other thing I would think hard about is eliminate casein. You're getting away with, whey protein now. Just to refresh those that aren't familiar, Little Miss Muffet sat on her tuffet eating her curds, which is cheese or casein, and whey, because it's separated off. Whey protein is the byproduct of making cheese, of course.
Yeah. Okay, well, that's it for questions.
All right. So the other features, I'm just trying to remember if we've missed some of the concepts. Treatment. Okay, so we've talked about treatments. We've talked about reducing the toxin load. We've talked about improving the body's ability to handle toxins. And Arlene alluded to part of it, because if you increase your whey protein and increase your cysteine, you'll have more glutathione in the body, and it's our number one way to reduce most toxins in the body. Probably why it was instrumental for me initially to some degree in my MS, because it helped me deal with the mercury excess. All right. So if we move on from there, what other features? So I want you on an exercise program, and that's got to be walking. Purposeful walking. There's no comparison for it. I don't care if you live in Minnesota or Saskatchewan, get out and walk 5 miles, 8 kilometers, 3 times a week. So go to the mall if you have to. Become a mall rat, if that's the term, but get that purposeful walking done. I'm not asking you to go out right now when it's 40 below, but get to the mall 3 days a week, because that really makes a difference how you will do long term. And so that exercise walking piece would probably be a very useful thing for Arlene to get in the habit. That's what I would do, because it might even help your essential tremor. I can't predict that, but I know it won't hurt it, and it may make a significant difference. And we do know that the exercise is a good thing anyway, because it increases brain-derived neurotrophic factor. And I would look really hard, because you may have an individual variation in your genetics that you don't handle toxins as well as the next person. Essential tremor, it's a handy name, and everybody walks home, because I have a good buddy who had it very severely. He's finally passed away. But it usually means something isn't quite right. Even though the neurologist says there's no treatment for it, that's what they say about almost everything. There's no treatment for your stroke. Sorry, go home, have another one, live a life, whatever you can. They say the same about MS, and they say the same to a degree about Parkinson's, although they lean on more and more and more L-DOPA. But these things don't have a great long-term outcome. Trust me, you're on your own, kid. So my goal of the book Solving the brain puzzle is to empower you to look after your brain, and you've got early warning signals, just as I did with my MS. I'm in 25 years now this year. You've got to do everything you can to slow down the problem and walk back up the neuroplasticity road to better well-being. So the other one I didn't mention was photobiomodulation.
Mm-hmm.
Just before my book came out, I talked about an individual case report of a woman, I think in her 70s, who had quite severe Parkinson's for some years. She had difficulty with her speech, difficulty with her, face, didn't have much of a smile or anything anymore, and difficulty walking, with frozen type walking. And so she started treatment at that time. It was the Thor helmet for photobiomodulation. And since then, Josh Crawford at the Genoa Laser Therapy. So if you go there, Genoa, Genoa, just like the city in Italy, lasertherapy.com, he now sells these for home use. Okay, so this was about 3,000 US. Okay, but I can use it, and I use it literally because it helps my MS considerable. And he can recommend, and these units are great. You can set them right from 3, a frequency of 3 up to 40, all right? Typical brain cleanup happens often best at 33, so that's often where I use it. Or if I'm trying to improve my sleep, and sleep can be an issue in the Parkinson's group too, sleep is often helped by setting it at 3, okay? Because that seems to enhance theta rhythm, which is one of the important brainwave components of sleep, deep sleep. So in the last thing in the evening, typically I'll put it on 3 because that will improve my sleep scenario. So at the same time, I encourage people probably to take a day a week off. I try to take a day a week off. It kind of lets everything reset or whatever it does. But we know that this can make a great difference in Parkinson's, all right? So well worth the purchase. I also use it, of course, for my headaches, and I'm mildly hopeful that it'll reduce my risk of Alzheimer's or dementia because I'm double the risk because of my MS. With my wife and niece, being a woman, she's relatively more risk of Alzheimer's troubles, and it probably helps prophylactic to that because we know how photobiomodulation tends to work. The simplest way I like to think of it is it dramatically improves mitochondrial function. Mitochondrial function, of course, provides the energy within the cells. There's up to 1,000 mitochondria in a neuron. Some of them can be very big because the neurons are very big. But if they're not functioning optimally, the cell doesn't have the energy. And that's why I'm softening my stance to saying that when we have symptoms, 70% of our cells are dead. I don't think so. There may be a proportion that are dead, but most of them are not functioning adequately. And they're not functioning adequately because they don't have the energy. Remember, neuron function is predicated on a huge amount of energy, every bit as much as a cardiac cell that beats every minute, all right? And if they don't get it, they don't die, but they go to sleep or inactive. But if you can renew their method of getting those mitochondria optimal again, and that's why I'm really big on coenzyme Q10, acetylcarnitine. You'll see it easily found as L-carnitine, but acetylcarnitine is better because it tends to get into the blood-brain barrier better. And then the third one I often talk about is D-ribose. Those are my supplements go-to to improve mitochondrial function, and they may be worth a trial of 3 months or so, at least, in a Parkinson's patient. And then, of course, we know now that photobiomodulation improves the function. The nitric oxide, which is excessively bound in part of the energy production pathway, is released from that. Nitric oxide is good if it's in the right place, and that allows the oxygen to get in. So that becomes a secondary backup possibility. You might do some hyperbaric oxygen. And if you've got availability to it in your Parkinson's, I would go for it personally. I mean, I'm up to 750, and I do it 5-6 days a week because I can't travel anyway, like anybody else. And it starts to make a difference to the energy function of those mitochondria. Okay.
One more question. I would like to have FMTs. There's still a place on the island we can do that. Is it safe if I am on Rituxan? I'm not sure what Rituxan is.
Well, Rituxan is one of the entities that help calm down the immune system. It's a biologic, okay? And so you've heard of several of them, and it's in that group. So you have to inject it every 2 to 4 weeks, and it tries to reduce the hyperactivity of the immune system. You can still take gut floral transplant in the presence of Rituxan, okay? You can't get it on Vancouver Island anymore. We had to close our facility 8 months ago, something like that, because of other issues. And it was also a challenge over COVID because people couldn't transport up from the United States, where a fair number of the clients came from. So I'm not aware of it available. There is some studies happening in Canada on different entities, but it doesn't happen. And the other thing that one could do in the presence of treating your, so you're on the Rituxan. You didn't say, Lindsay, oh no, okay. Tried it for your MS, but you don't have Parkinson's. Yeah, no, it's fair enough. And gut floral transplant can make a difference in MS. It's not necessarily revolutionary, okay? But I have seen some people that was, restored their ability to walk. I mean, I was still walking, but it meant improve my cognitive ability considerable and include my energy considerable. So I will occasionally do top-ups. So far, I've got a few that I've had on hand for a few months, but those are becoming less and less possible. And right now, gut floral transplant, the facility that had it in the Bahamas, I think you were telling me, they got their implants from the UK, from Tmount, the same as we did. They've been transferred into a COVID-only facility in the Bahamas. Slovakia, I don't think, is doing it anymore either. They were doing it for a time in Bratislava. And I think it's a real challenge to get in and out of the Britain, so I wouldn't want to bet that that's an easy path for you either. So the other possibility is to try and improve the diversity and the well-being of your gut. And I can't make any higher suggestion, not contacting me, but contacting Christina at mindmoodmicrobes.ca, okay? And contact Christina for assistance in each of those steps. And she may have some additional ideas to what I have to improving that microbial diversity, even help you test it to see if there are particular focuses. You know that you have MS, that may give a little more ideal ways and places to focus. And the possibility exists as time goes on, there may be other places to find implants.
Yeah, even without implants, you can definitely increase your diversity. We have one person here. I'm not sure if she's watching today, and I don't know if she wants to be outed, but she has MS, and we recently got her diversity to 100%, which is as high as it can possibly be, at least within the testing world. So I'm super proud of her. And if she wants to out herself in the comments, she can do that, and I'll mention her name.
Sure. Okay, and so we've got another question from Jody. Do I recommend eStim? So this is, I believe, an MS question. So eStim is electrical stimulation of some of your muscles. Because, of course, if you have MS, as I do, your muscles are still working okay, and your peripheral nerves are still working okay, but the message being sent to them is reduced. So eStim can short circuit that, and you're putting the stimulation on the muscles so that they fire on their own. So it's not unreasonable. I would primarily use it in an effort to increase my walkability. Dr. Terry Walls used eStim quite successfully when she was smoking. She could only basically survive in a recumbent wheelchair, but she became mobile on her legs, and part of it, because the muscles, no matter what the reason they're not working, they get lazy and atrophy or almost disappear. And we've all seen that. I mean, you put me in a wheelchair for 6 weeks, for 3 months, which I had when I had a fractured ankle, almost all the muscles disappear, but you can start to retrim them. And one of the methods is eStim. Another one that I'm very keen on is the vibration machines, or as my friend calls it, the jiggler, okay? you get on it and you, but it's firing the 3 types of muscle fibers. And I think it's even a better choice personally, because they're not all that expensive. Sometimes people have bought them, quit using them. I saw them first with a kinesiologist in South Africa. The woman I was visiting and trying to help with her MS, she would kind of hobble in with her MS. She would be 20, 30 minutes on the vibration stimulator. This one was made in Holland, but they're now made other places too. They're fairly well designed because it fires your slow twitch fibers, which are the ones you use when you walk. It fires your fast twitch fibers, which is what you use when you run or jog. And it even fires your super fast twitch fibers, which are the ones you jump, take your hand off the stove, or you see a tiger, and now you can really move because the fast twitch fibers, all 3 are fired by the vibration machine. In fact, they were introduced and developed by the Russians for their cosmonauts. And their cosmonauts could stay very healthy, spending time. The minimum is 12 minutes 3 times a week. That's not too bad, okay? And you can move it on to do other components, including exercise, push-ups, or any kind of thing you want to do on it. But it literally kind of triples gravity, but it fires those muscles off. At the same time, you want the brain to be continued to retrain. This is neuroplasticity, to be retrained, always with that effort to get that walking back or get that walking normalized, solve that drop foot in the MS case, or any of those features. I mean, I had a drop foot very pronounced for 2 or 3 years. Nobody can see it now, happily. Okay, I think we're getting up to the magic time. As far as next week, I think next week we will skip a chapter. My next chapter is in the book is on issues of mold toxicity, as well as Lyme, as well as CIRS, chronic inflammatory response syndrome. It was written by Dr. Karen Johnson, medical school classmate of mine, very brilliant woman. And I will talk to her and see whether we might do a split screen with her at some point. But next week, I think we will take the next chapter, which is on mental health challenges. So that'll include things like depression, anxiety, schizophrenia. These are also neurologic issues, even though they're in the psychiatric realm. The brain, it doesn't matter whether you see a neurologist or a psychiatrist, it's still brain problems, and they have a lot of the common same themes. So next week, that's what will be our topic.
Okay.
So, thanks very much. It's been, of course, Bill Code and Christina Mitz. And if you want to see these, weren't able to see them today and want to look at them, go to Dr. Bill Code, DRBILLCODE.com, click on blog, and they'll be listed there. They'll be on a YouTube, so you can download them, so you don't need to be on Facebook. Or you can do an audio podcast download, because we'll put them onto audio for you as well. So then you can travel. And please, if you're going to drive, just do the audio. Okay. So thanks very much. Thanks, Christina. Another good week again. So we've talked about Parkinson's. Bye for now, folks. Have a great week.